I know Droplet and Airborne precautions can get a little confusing. So user memory tricks PIMP for Droplet precautions and MTV for Airborne precautions. So just think you're on air with MTV, like music television. And think of Pimp My Ride, like that old TV show, when you're dropping your lowrider really low. So for Droplet precautions, P is for Precautions, I is for Influenza, that normal flu every year. M is for meningitis, specifically bacterial. And P is for pneumonia, basically pneumonia. And for airborne precautions, M is for measles, T is for TB tuberculosis, and V is for varicella. Now, a lot of test questions come from PPE here, so write this down. For droplet precautions, number 1 is surgical mask and goggles, and number 2 is a single room. Now, ATI mentioned that we teach unlicensed personnel to wear a mask. And for airborne precautions, the number 1 thing is staff must wear N95 masks. The patient has to be in a negative pressure room, the door must be closed, and here is a tricky one, write this down. When you're transporting the patient must wear a surgical mask. Now, a few different textbooks had different things to say about this, but overall, surgical mask was the most recommended when a patient leaves the room. So guys, write that down. Not N95, but surgical mask. Now, a little side note here. Don't let the Nclex trick you here with those fundamental questions when you're putting on and taking off PPE. So when you put on or don PPE, just think the gown goes first, the mask second, goggles, and then lastly gloves. And it's almost the exact opposite when you're taking off or doffing. Gloves are first, then the goggles, and here's the tricky one, the gown third, and then lastly the mask fourth. Now for the top 2 missed questions from this section. Question number 1. A patient presents to urgent care 48 hours after a tuberculin skin test. The site looks red and raised with a 19 millimeter in duration. The nurse knows which of the following. Select all that apply. Okay, now before we look at the options, from the TB video, you know that TB is an airborne infectious disease. And anything over 15 millimeters is positive for TB infection. Now the real question is this. Is the TB active or inactive, aka latent? So we definitely do a chest x-ray to confirm the status, or 3 early morning sputum samples on 3 consecutive days. So option number 1, anticipate orders for a chest x-ray or sputum samples. Yes, we have to confirm if the TB is active or inactive. Now option number 2, this one's a little bit tricky here. Collect blood for a quantiferon TB test. Now you're probably asking yourself, what the heck is that? Well, this test can actually be used for an alternation of a TB skin test, but in practice, we typically do an x-ray or a sputum test first. Now, option number 3, the patient has active tuberculosis. No, this option is incorrect because we don't even know if it's active or inactive. That's why we have to do option number 1, all these tests to confirm that. Now, option number 4, the patient has a tuberculosis infection. Yes, this is true. So write this down, guys. The body has developed antibodies and shows presence of TB. But again, even though the patient is infected, it doesn't mean that the patient is contagious. Only active TB is contagious. Now, option number 5, immediately place the patient on droplet precaution. No, we place the patient on airborne precaution. And it's only done for active TB patients, and the patient's not really confirmed for active form yet. But this option is wrong because, again, TB is airborne precautions and not droplet. Now, question 2, when caring for a patient with bacterial meningococcal meningitis, the nurse implements which of the following? Select all that apply. Okay, the key word here is meningitis. So before looking at the options, what do you know about meningitis? Well, meningitis is the inflammation of the meninges, right? It's an infection. So any head inflammation can lead to increased ICP. So we want to make sure to keep the lights and noise low, as well as watch for seizures. And meningitis is highly contagious, especially bacterial, requiring droplet precautions. So remember the M in our acronym PIMP stands for meningitis. And only surgical mask and goggles, not an N95. So surgical mask is required here, as well as a single room and not a negative pressure room. So option number 1, advise the unlicensed personnel to wear a surgical mask. Yes, the key term there is surgical mask, not N95. Now option 2, implement padded side rails. Yes, seizure precautions, especially for that increased ICP, which is very common with meningitis, that infection inside the meninges. Now option 3, keep the light and noise low in the room. Yes, once again, for that increased ICP risk. And option 4 and 5 are incorrect. Place the patient on a negative pressure room. No, this is only done for airborne and not for droplet. And put the patient on an N95 mask before entering the room. No, again, this is only for airborne. For droplet, we use that surgical mask as well as the goggles.